Good morning everyone. Welcome back to channel Medical with Sanju. हामीले हेरिरहेका थियौं नर्मल लेभरमा एमसीक्यू क्वेशन जुन कन्टिन्युली चलिराखेको छ अहिले रिमेनिङ क्वेशन हेरौं क्वेशन नम्बर 726 normal fetal heart rate is option A 90 to 100 irregular, option B 100 to 120 irregular, option C 120 to 140 irregular, and option D 120 to 160 regular. Normal fetal heart rate is 120 to 160 beats per minute at term. FHR is slightly decreased during uterine contraction due to vagal stimulation. Option D is right answer. Question number 727. A significant predictor of fetal well-being is if fetal heart rate is option A 100 to 120 beat per minute, option B 120 to 160, option C 160 to 200, and option D 180 to 200. 120 to 160. Option B is right answer. Question number 728. Which of the following indicates an abnormal physical finding for fourth testing during second trimester of pregnancy? Option A. Consistent increase in fundal height. Option B. Fetal heart rate of 180 beat per minute. Option C. Braxton Hicks contraction. And option D. quickening. Fetal heart rate of 180 beat per minute. Option B is right answer. Question number 729. A nurse performed assessment of patient posted for cesarean delivery. Which assessment would indicate need to contact the doctor? Option A. Hemoglobin of 11 gram. Option B. Fetal heart rate 180 beats per minute. Option C. Maternal pulse of 84 beats per minute. And option D. White blood cells of 12,000 per mmq. Fetal heart rate more than 180 beats per minute is right answer because the normal fetal heart rate duration हुन्छ 120 to 160. Question number 730. During labor, FHS must be auscultated. Option A. Midway between contraction. Option B. Immediately before the next contraction. Option C. Immediately after the contraction. And option D. As near to the hinge of a contraction as possible. Immediately after the contraction. Option C is right answer. Question number 731. A woman delivered this morning because this is her first child. Which of the following goals is most appropriate? Option A. Early discharge for mother and baby. Option B. Rapid adaptations to role of parent. Option C. Effective education of both parents. And option D. Minimum need for expressions of negative feeling. Effective educations of both parents. Option C is right answer. Question number 732. Measures used to avoid a perineal tear in a primigravida in labor. Option A. Deliver the head in between contraction. Option B. Perform a timely episiotomy. Option C. Encourage delivery of head by expansion after nape of neck appears below pubic symphysis. And option D. Avoid spontaneous forcible delivery of head. Perform a timely episiotomy. Option B is right answer. Question number 733. All of the following must be monitored by nurse during second stage of labor except option A. Uterine contraction. Option B. Descending or presenting part. Option C. Maternal comfort. And option D. fetal condition. maternal comfort. Option C is right answer. Question number 734. Sudden gush or spot of blood or lengthening of the umbilical cord after the delivery of the infant indicate. Option A placenta accreta. Option B retained placenta. Option C abruptive placenta. And option D placental separation. Signs of placental separation are slight gush of vaginal bleeding, lengthening of umbilical cord, slight increase in a fundal height, slight bulge in a suprapubic regions, and globular and firm uterus. Option D is right answer. It is the sign of placental separation. Question number 735. All the following are sign of placental separation and descent except option A, fundus becomes rounded. Option B, shortening of cord. Option C, a small fresh blood loss. And option D, lengthening of cord. Shortening of cord is not the sign of placental separation. Option B is right answer. Question number 736. The earliest sign of placental separation is option A, sudden cause of blood flow for vagina. Option B, change in the shape of uterus. Option C, increased height of fundus. And option D, shock. Sudden cause of blood flow for vagina. Option A is right answer. Question number 737. Schulz method and Matthew Duncan method describe. Option A, method of detachment of placenta. Option B, delivery of presenting part. Option C, way to monitor fetal heart rate. And option D, way of presentations of the fetus. Method of detachment of placenta. Option A is right answer. Question number 738. Which of the following is performed by nurse during third stage of labor? Option A, getting urine specimen for laboratory test. Option B, assessing uterine contraction. Option C, asking patient to push. And option D, monitoring placental separation. Monitoring placental separation चाहिँ गर्नुपर्छ थर्ड स्टेज अफ द लेबरमा. Option D is right answer. Question number 739. During the delivery, the perineal tear extends through the expenditures of a rectum, but the rectal mucosa is intact. How would you classify this type of perineal tear? Option A, first degree. Option B, second degree. Option C, third degree. And option D, fourth degree. Perineal tear third degree मा हुन्छ. Option C is right answer. हेर्न सक्नुहुन्छ. Laceration of the perineum during delivery called tear of a perineum. There are 4 degrees of severity caused by overstretching of the vagina and perineum during delivery are first degree, second degree, third degree, and fourth degree. In the first degree, tear involves superficial tissue of the perineum and vaginal mucosa but does not injure mucosal tissue. In second degree, tear involves those tissue included in a first degree tear and the muscles of the perineum but not the of the anal sphincter. In third degree, tear involves all the tissue of the second degree tear and the of the anal sphincter. And in fourth degree, tear extend completely through the perineal skin, vaginal mucosa, perineal body, anal sphincter muscles and the rectal mucosa. यो साइ हुन्छ. यो पनि धेरै नै इम्पोर्टेन्ट क्वेशन रहेको छ. क्वेशन नम्बर 740. थर्ड डिग्री पेरिनियल टियर इज इन्भल्भमेन्ट अफ ऑप्शन ए vaginal mucosa, ऑप्शन बी urethral mucosa, ऑप्शन सी lavistar muscle and ऑप्शन डी anal sphincter. थर्ड डिग्रीमा anal sphincter इन्भल्भ हुन्छ. ऑप्शन डी इज राइट आन्सर. क्वेशन नम्बर 741. Posterior perineal trauma involving anal sphincter falls under option A first degree, option B fourth degree, option C third degree, and option D second degree. third degree. Option C is right answer. Question number 742 is not a cause for perineal tear. Option A, rapid perineum. Option B, face presentation. Option C, large baby. And option D, gynecoid pelvis. Gynecoid pelvis is not a cause for perineal tear. Option D is right answer. Question number 743. Who discovered partograph? Option A, Dr. R.S. Philpotter. Option B, Dr. A.L. Modalier. Option C, Dr. William Shaw. And option D, Dr. Shirodkar. Dr. R.S. Philpotter discovered partograph. Option A is right answer. Question number 744. Partograph is the first planned by option A, Robert. Option B, Jackson. Option C, Friedman. And option G, Chadwick. Partograph is first planned by Friedman. Option C is right answer. Next question in other video.